The 7 investigators have exposed gaping holes in Michigan's mental health code that have been blamed for the deaths of mentally ill men and women. Now, those reports here have led to legislation in Lansing that mental health advocates say could save lives. Investigator Ross Jones with big developments.
Frankly, I think your series has had a lot to do with this, because it's put a human face on all the things we've been saying for all these years.
Over the past year, we've done more than a dozen reports profiling the men and women failed by Michigan's mental health system. Several stories follow the plight of Bill Becker, who sought help under Kevin's Law.
Some days I can't even function.
The law was passed in 2005 to create mental health treatment that had never existed before. Long-term outpatient care lasting no less than 6 months. It was designed to hold mental health providers accountable for ensuring that patients stayed well long after they left the hospital. The law allowed judges to order services like a case manager to oversee a patient's care and regular therapy sessions too. But as we discovered, in virtually every Michigan courtroom, the law had never been used.
Here in Genesee County, I've had 0 petitions ever filed on Kevin's Law.
Never been used in Kalamazoo County.
After our reports, Lieutenant Governor Brian Calley convened a special task force to understand why the law was such a failure. There are plenty of reasons, from being overly complicated, misunderstood, and underfunded. The task force came up with dozens of ways to strengthen the law, and those changes are found in this bill. Current law requires a serious incident like an arrest to occur before Kevin's Law can be ordered. But under this legislation, that would change, allowing a family member to request treatment before someone's in crisis.
It allows for earlier intervention at a point where a person is not yet in that crisis point where they're already perhaps done some irreparable harm.
Now, the bill has been referred to the House Committee on Health Policy, and Stephen, it is expected to receive its first hearing as soon as July.
So, Ross, if this does pass, more mental health agencies will use the law, but how do we know they understand exactly how to use this law?
Well, that's a very good question, because if this bill or if this law has 2 problems, the first is that it is underused, and the second is that in many cases when it is used, it's clear that the mental health agencies don't know exactly how to follow it. So, in fact, we've done a story about one man, the first case in a county that used Kevin's Law, who only a few months later he died. So the reason or the way to address that, at least the Lieutenant Governor hopes, is by creating sort of an education portion to go along with this bill. He has, at this point, put money in the state budget to hire 2 new community mental health employees whose full-time job will be basically to travel the state and make sure that folks know how this law is supposed to work, how to make sure that patients don't get worse, and to try to make sure that this is better understood going forward in Michigan.
Now, the bill sponsor says he expects wide support, and in my experience, they always say they expect wide support. Do you think he's going to actually get it this time?
You'd be surprised if he didn't expect wide support. There's going to be a fight. Anytime you have questions about civil rights being taken away or an easier way for a court to add or to take action for someone, whether they have mental illness or not, there's going to be a debate. So he will indeed have a fight going forward, but something clearly needs to change with this law.
And there will be funding involved. They'll fight over that also. All right, Ross Jones, thank you so much. We'll talk to you again in about an hour or 2 on Action News at 6. In the meantime,